Now, with modern technology, it is possible to get an HIV test in just 15 minutes and to do so in a local clinic. Since May of this year, HIV testing has become part of the standard medical services provided by the state.
Throughout Ukraine, it's possible to find out your status through a family doctor. They test people, but earlier this didn't exist.
Ullyana is HIV positive. She found out her status by chance.
I was infected by my child's father. It was about 15 years ago, and my child is now 15 years old. Thank God he's healthy. And it turns out that I've been living with HIV and didn't know it. When I was in serious condition in the hospital here in Kyiv, doctors diagnosed me with HIV.
According to a Ukrainian study done by the charitable organization Positive Women in 2016, HIV-positive people reported being treated with disdain, primarily in hospitals.
Women living with HIV experience the highest level of stigma, self-discrimination, while communicating and receiving medical services in medical institutions. And this applies mainly to nursing staff.
Ullyana says that the situation changed in 2018. Doctors have become more tolerant, and thanks to medical reform, more people are getting tested, which means the number of people being diagnosed with HIV has increased.
In the first 9 months of 2018, compared with the same period last year, the number of newly diagnosed HIV-positive people increased by 158. It doesn't seem to be such a big figure, but this is a growth trend. The positive thing is that these people have more chances of getting treatment and having a healthy life.
Today, having HIV is not a death sentence and will not automatically become AIDS. Instead, it becomes a chronic disease like diabetes or high blood pressure that people can live with for their entire lives. And nowadays, 90% of antiretroviral drugs, those needed to keep HIV under control, are purchased today by the state and given to patients for free.